Do you feel bombarded by confusing messaging about what to do and how to behave during the pandemic? Do you feel hesitant about taking the vaccine because there's so many conflicting opinions? How do you sort out what information is valid and what is not? I asked pandemic historian and city councillor Jamie McAvoy what makes communications around COVID so difficult to interpret at times. We were going to talk today about messaging vis-a-vis COVID, and that messaging seems to be confusing for people. So what are your observations?
Well, I decided to Google COVID confusing messaging, and it came up with 1.5 million results. So it's a problem. I think the messaging is confusing for people. I think more so than in the last pandemic, and I think that there's a few reasons for that. One is fairly obviously the conspiracy messaging. The internet conspiracy thing is a very modern way to do it, but it's not abnormal for people in times of stress to be in denial, to go through different stages, trying to come to terms with this. So I'm not really surprised that there's that kind of element out there of the conspiracy messaging. It is a business. There are people making a lot of money off of YouTube putting out conspiracy messaging, and they're going to keep making money like any other business, and so they're going to keep coming up with new products to sell, new conspiracies to sell, and new details of conspiracies. But the problem is a lot of people are exposed to it who don't know it, right? Mm-hmm. You get something on your Facebook, and it's a picture with some words on it, and it sounds convincing. Those words might say, look at this empty hospital corridor, or there's no epidemic. Mm-hmm. And then it will turn out that that empty hospital corridor photo was taken 5 years ago at a newly built hospital or something.
Right.
So that kind of thing I think is really difficult for people to sort out. And it comes with a heavy dose of false expertise, Not everyone knows the difference between public health medicine and, say, neurology. But, when someone comments and they have a title doctor, they might even be a sociologist or something. But there's a lot of that where people are claiming expertise. How you know it's a problem is when they don't cite the science to back that up, right? Mm-hmm. So if somebody is on your YouTube or on your Facebook and says, this X thing is true, well, when I do my updates, I try to link the study for you, right? So is there a study in the Lancet? Did a university do a study? What's the evidence for the truth of it? We also have this mistaken idea. It's very American, but Isaac Asimov said there's a cult of ignorance in the United States, and there always has been. The strain of anti-intellectualism has been a constant threat, winding its way through our political and cultural life, nurtured by the false notion that democracy means that my ignorance is just as good as your knowledge. That's Isaac Asimov. And
interesting.
There is this idea that facts and science and information are a matter of debate. Well, they're only a matter of debate when we don't have enough facts to arrive at a conclusion. Otherwise, science, when it has enough fact, enough information, it comes to a conclusion. For example, we know that masks can block a significant proportion of the respiratory droplets that come out of your mouth when you're breathing and talking and so on. We know that through science. So there is a difference.
What part of the portion of the population do you think is susceptible to this messaging?
My honest answer is all of us, right?
Okay.
There's a lot of studies on how people are more likely to believe what jibes with their life experience. That isn't just about whether your politics are left wing or right wing or those kinds of things. It could be as simple as you had bad experiences with authority at one time. So when somebody tells you something in the name of authority, you might have more of a resistance to believing that. Some of it is quite subtle. There have been some social media posts that have gone around from the perspective of different people. And so, one that I remember was talking to single moms about the dangers of vaccine from Jenny from Massachusetts. I knew right away Jenny from Massachusetts did not write that very professionally written short essay. And when you try to find Jenny from Massachusetts on Facebook, it goes to a dead-end account, and that's the only post on that account. So,
Right.
but those things are influential, and they're not upfront. They're not transparent. There was a letter from some doctors in America, and they had kind of an odd argument, but a lot of their argument was that the public education about COVID was making people afraid to go to hospital. And then they showed the figures for how many people are afraid to go to hospital. Well, that was a group of about 1,000 doctors, and those doctors, they were Republican Doctors for Trump. They're an actual organization. They had a political motivation. And what they left out of their analysis, their fact was true. People hesitate to go to hospital in the United States. What they left out was people hesitate to go to hospital mainly because of financial concern, how much it's going to cost you to go to hospital there. So, these things can be persuasive, partly because they're not transparent. And the most persuasive have some kind of little bit of truth or believability in them. So I think we're all susceptible to it.
I guess a lot of people don't know what a credible source is, or maybe they know what a credible source is, but they don't really want to track it down. Or you have one or two people that are doctors who are real doctors, but believe something else, or choose to believe something else for the purposes of publicity. Or, we've seen this happen in the cigarette industry. We've seen this happen in the oil industry. You get a couple of people who are backed by, big money to say what's counter to what is largely believed. So I think it's probably pretty difficult for people to, I don't know if you have some suggestions there, but how do people go about making sure their sources are good?
I have some favorite media sources: the New York Times, the Seattle Times more locally, BBC, and, for Greater Vancouver, something as simple as watching the Global Newscast each evening, or CBC. Most of those sources will tell you where their information came from in their reporting. If you're watching, say, BBC, and they say the AstraZeneca vaccine is less effective on the South Africa variant, they will tell you where they got that information from. They will tell you why they're saying that. And the topic itself is examining a kind of a factual situation. If you see something where somebody is simply talking and giving their opinion and not citing any science or study, that's not a credible source, even if it comes from mainstream media. Mm-hmm. And there's a lot of what is called received wisdom, where a person seems, attaches some credentials to their name, and you're supposed to believe them just because of who they are, not because of the information that they provide you. So a credible source would be a source that actually gives you some information that, if you really wanted to, you could go look at that scientific article, you could go find some further information. And I think a lot of people are off put by that. But it's not actually as difficult to look at that material as people might think it is. If you look at the Lancet Medical Journal website, if you go to the Johns Hopkins website or the World Health Organization, these are places that are posting up-to-date studies on the situation with COVID. They nearly always have a page of fairly plain language at the beginning that explains how their study was done and how they came to the conclusions that they did.
Mm-hmm. Well, I imagine there's some large portion of the population is sort of, I don't know, the modern version of counterculture, whatever the authorities of any sort say has got to be wrong. You know, like if you're over 30, which was the 60s thing, you don't have anything useful to say to me.
Mhm. I'm sympathetic to that, actually. You know, I had someone who, I do have some people I know who are anti-vaxxer. I'm not going to tell them through Facebook that I'll never speak to them again. You know, that doesn't handle the situation. First of all, these reactions are actually pretty normal in human terms. Reactions of denial, wanting to find another side of a story, all these kinds of things. But you know, if a government's approach is to simply say we're mandating this because science, well, there are people who can cite examples of when science has done wrong. So it really needs to go deeper. It really needs to talk about, well, what was the science that said this vaccine is safe, for example? How did they conclude that, right? And when you look at even specific communities, you know, there's some articles about the United States talking about how among Black people, there's more hesitation about getting a vaccine than among non-Black people. And that talks about some of the history of medicine that has occurred, right? And you could find some of that same thing with Indigenous people in Canada.
But also, even when, you know, talking about mixed messaging and kind of trying to get a hold of messaging, even if it's good, you know, if it's coming from good sources, it is very confusing because we've gone, you know, for example, we've gone through, we wear masks inside, but not outside, but now outside too. Now it should be 3 layers and 1 layer should be a certain type of material. I mean, this is from our national medical officer. But that seemed to sort of disappear, that idea that you have to have a 3-layer mask with a particular material. Then there's the whole N95 mask thing. Now there seem to be available. My daughter just bought a 20, you know, package of 25 from Costco. So they wear an N95 and another mask over top. That's an example of confusion because generally, you don't want to have to kind of think about this every single day. Do I wear a mask? Do I not wear a mask? Is it outside okay? Is inside okay? What's inside is, if it's inside's okay in a restaurant, why are some restaurants closed and some restaurants open? It's pretty confusing.
It is confusing. I think we're best off understanding that that's to be expected. And the reason is because we're learning about this virus and how it works and what works as we go along, right? So there's a lot more information today than there was in January, right? We're dealing with different situations as we go along. Some of the new measures you're hearing, they're about trying to prevent a more contagious variant from getting hold, which has already gotten hold in Britain and South Africa and parts of the United States. If you're fighting a war, you have a plan. I think it was Patton who said, planning is essential, but plans are useless, right? And Eisenhower said, a plan is what you have before everything goes to hell. So things change, and you wouldn't expect in a war or a battle that you would stick with your plan no matter what new information came, no matter a change in circumstances. And it's the same with fighting a virus, that the plan has to change based on what we learn, what's happening. And, you know, the plan is very different in British Columbia than it is in some other area of the world that might be much more affected right now. So confusion kind of comes with the territory a little bit. Confusion also comes when people are hearing what they don't want to hear, right? You know, when the government limited indoor exercise, a lot of people felt confused about that and wanted examples and so on. We tend to feel confused, and there's actually good studies on this. We tend to feel more confused when we don't like what we're hearing. Even if someone tells you you have a medical condition, if a doctor tells you you have a medical condition that threatens you, you're much more likely to want them to check on that or get a second opinion or those kinds of things, even if it was established in a factual way. On the issue of masks, I'm of two minds on it. One is that in the early days of the pandemic, they just weren't available. And government was doing everything they could to make sure that any mask supply went to the healthcare system. But the arguments also said things like they're not effective, they give people a false sense of security, people touch their face a lot. And you sort of had common sense conflicting with what the official advice seemed to be. Like, when I wear a mask, I might touch my face a lot, but we do that anyway, and at least I'm not sticking my finger in my mouth, you know. When you had medical professionals wearing masks and other people were being told that it's not very important. And we had the advice about social distancing and washing hands being most important, but that didn't help when you were on a bus, right?
Yeah.
So the other thing I'll say about that is that, you know, historians knew that mask wearing has typically been effective in a pandemic, and there had been studies on that in Asia, but those studies early on, in fact, before March, but those studies didn't hold water in the Western world. And it wasn't until a European and an American university came forward and said, yes, we studied masks and they're effective because they block the size of the droplets that come out of your breathing. So I think that when we step back and review this pandemic, I think one of the things we really have to look at is Western bias. And those countries that adopted mask wearing early did much better, frankly.
Mm-hmm. So those countries would include what countries?
They would include South Korea. They would include, let's see, Taiwan, China, for that matter, Vietnam.
Japan?
Vietnam has had 35 deaths in the pandemic.
Really? Well, I think often it comes down to the particulars when people are confused. They get confused about their children at school. For example, children aren't vectors, but then something happens in a school and so what now? Apparently they are vectors.
Worldwide, whether schools should be open or not has been probably the hottest topic in almost every country. It's not an easy one because, we know that children are affected at fairly low levels in terms of the seriousness. So we have to have schools that try to protect the teachers and the workers and not have outbreaks where children might then go home to grandparents living at home or something. But there's also a lot of study about the damage that's done when schools are not in session and the limited effectiveness of online learning and how the gaps that exist between children now become more pronounced when school's not in session. And so when you're looking at a pandemic that, when we had our initial shutdowns, they were officially for a few weeks, right? After a year, you really do have to sort of look at what's the effect of having schools shut on children, look at what the effect is of having schools shut on families, and then look at how serious is this disease affecting children, right? And I don't envy the public health officials who have to try to make those calculations.
To me, one of the kind of the worst areas of messaging, and maybe it's not so much message, well, it's messaging, but it's messaging to institutions, and this is, retirement homes, don't let anybody in. So what we have is all these people dying from neglect, never mind COVID. They're not getting fed, they're not getting the water, the hydration they need. That is terrible. And now I guess they're sort of beginning to realize that, gee, maybe we should let some of the families in to help out.
Canada, to be honest, Canada doesn't have much to be proud of here, right? We don't have vaccine manufacturing capacity because we used to have it and it was privatized in the 80s. Our military, and I've read the reports on Quebec and Ontario. I encourage anyone to read them, but make sure you have a seat first because they're not nice. talking about how elder care has worked in Canada. At one time, Canada had a 7% mortality rate. It was actually one of the highest in the world. And at a time when the world was having about a 2.5% mortality rate.
Are you talking
And
about in
the
general?
reason for that was because of the conditions on our old age homes, which are very crowded, very slow to respond. They had the economic situation for the workers is terrible. So you had people trying to work 2 jobs, sometimes more than 2 jobs, working in different facilities because a lot of people were restricted to part-time work. So we just didn't have good conditions. And if nothing changes out of that, I think that would be very sad. I know that Premier Horgan has said there will be $1.8 billion spent in BC so every senior can at least have their own room. But, you know, imagine this situation. You have a virus ripping through, you know, an old age home or a care home, and you have, in some of those homes, you have 4 people to a room. How are you going to contain that?
Yeah. Yeah, so it seems to be a major failure in how the being regulated or governed, obviously.
It's a pretty major failure. It's been worse in private care homes than in public care homes. There was no sort of inherent connection between public health authorities and old age homes. I mean, you know, doctors would be sent to treat people. But in terms of a kind of a response to a disaster like this, there's no plan. To call it a bad situation is an understatement.
So any general advice for people in terms of messaging? I mean, does it make the most sense to just go ahead?
Try to have one source that seems to be reliable for your messaging, right? You know, I try to do that with the updates that I post on Facebook. I haven't been able to do those regularly lately because of this frozen shoulder condition, but I'm still getting them up there. Watch an evening newscast. Make sure you're watching news, not the opinion part. You know, if you watch CNN, it's opinion 80% of the day, and news 20%, right? So it's not about people talking about it. It's about what is actually being reported as news stories. You know, and I'll say, honestly, that's also calming, right? When I see the people on my social media who are really into the conspiracy theories or really into the idea that this is all a big secret government plot, I actually think those are among the most stressed out people, right? I mean, whatever they are believing, they're obsessed with the pandemic and talking about it every day, trying to convince other people that they're right. So I really see that stress reaction. I mean, if you find yourself a couple of reliable sources, honestly, it will really help with your stress about the situation. Otherwise, it can continue to just feel like there's so much information out there and it's all conflicting. It's going to continue to seem conflicting because things change. And social media doesn't care if the story was from yesterday or 3 months ago. It continues to have a life on social media. So try to have some kind of source where you're getting up-to-date information daily or weekly, whatever you like.
And being in Canada, it makes sense to pay attention to whoever the medical director is for your province.
In Canada, we're really doing well in Canada. You know, you pay attention to Dr. Theresa Tam nationally, you pay attention to your public health officials provincially, and pay attention to those people because, you know, the news you get out of California is not the same circumstances as we have here, right? So pay attention to your provincial representatives. They're the ones that are dealing with the pandemic that you're living in.
I would imagine too that I don't know what portion of the population actually watches the news. I think older people tend to, but I don't know whether younger people watch the news or not necessarily even watch the news, but read the news.
Yeah, I'm a bit of a news addict myself, but So I every day I read some international, national and provincial and local news. I have been reading American news every day for a while, but maybe I can let that go now. We'll see. It doesn't
Mhm.
seem to have the same urgency
Mhm.
anymore. But yeah, my mom tells me that she watches global news every night at 5 o'clock, and that's where she's getting her information from. And part of her getting the information is that every day she's hearing what Dr. Bonnie Henry had to say about it,
Yes.
right? She's
Right.
hearing what Adrian Dix had to say about it. She's hearing numbers that are the numbers for British Columbia, not for somewhere else. And so I think that really does make a huge difference.
Now, if people they hear the news, but if people have questions above and beyond that, do they have a place to go? Do you go to the CDC of BC, and do they have some information that's more granular about, okay,
Yeah.
you know,
So CBC has some. CBC actually has a little COVID information section, and it includes questions and answers that they update almost every day. Public Health Canada website has a lot of factual information about COVID. So does the health authority. So the Fraser Health Authority has the information, everything from what are the current outbreaks to how to wear a mask properly, right? So I would say that if you look at CBC's COVID website, if you look at Public Health Canada's COVID website, if you look at Fraser Health, and don't be intimidated. This isn't information for doctors. It's information intended for you and me, right?
And if you feel your answers are not there, can you phone somebody? Is there a phone number, or is there a way
Phone
of
the BC Nurses line if you have questions.
the BC Nurses line? Okay, that's a very good idea.
Yeah, one of the things that Health Minister Adrian Dix did early on actually was dramatically beef up the BC Nurses line so that they could answer calls in a timely way. And so it is a potential information source. And if you have a cough or you think you have a symptom and you're not sure what to do, call the BC Nurses line.
Do you think we're going to have a bad third wave?
I think we have a good shot of avoiding a third wave. I think the world is going to have a third wave. I think some countries are effectively in their third wave now. It is a real race, to get this vaccine to people before more people get sick, right? We're going to have a summer like last summer, probably. We're going to have a summer, and you're going to start to see a situation where more and more people have been vaccinated. That's not going to immediately lift the public health measures because there's still going to be vulnerability out there. The thing is still out there and spreading. And normalcy is going to be based on what actually happens with the numbers. When the number of cases go down and the number of deaths go down, that's when we'll see public health measures being lifted. That's when we'll see something like normalcy return.
Well, all I can say is I hope somehow we don't get overwhelmed with these more contagious streams that are coming out of South Africa, Britain.
That's a pretty serious issue in those parts of the world that are going to be vaccinating more slow, right? That are not able to, beat the rich countries in terms of buying vaccine or distributing vaccine to people. And so, countries that are currently out of control, like South Africa, like Tanzania probably is. Tanzania insists that COVID is over. The president of Tanzania tells people to gather in churches and pray it away, and they've stopped reporting their cases. So probably out of control in Tanzania.
Right.
It's on the rise in Britain again. In fact, the new variant is the most common variant now in Britain. So the country I really worry about is the United States, to be honest.
Yeah.
And the reason I worry about the United States the most is because that's a country where only 2/3 of the people say they're willing to get vaccinated. And that's not enough. So I'm hoping that Americans will drift into a willingness to get vaccinated. I actually think that's possible. I think that it will become, not now, but later, it'll become so easy to get vaccinated. Every time you go to a doctor, they'll ask you about it. So I think the Americans will get there. But right now, with only 2/3 of the people willing to get vaccinated in a country where infections are as high as they are now, I'm actually most worried about the United States because of that kind of belief system.
Okay, well, thank you so much.
Okay.
Yeah, great.
Thank you.
Have a good evening.
Have a good dinner.
Will do. Have to think about it.